10 new cases in Singapore today. So 9th of March 2020. So 10 new cases confirmed, and for the good news part, we got 3 cases discharged. So let's take a look. So we have 6 from the cluster, which is from SAFRA Jurong. SAFRA Jurong is actually the club for the soldiers in Singapore. It's a private function, happened on the 15th Feb. And this one is now the biggest cluster here in Singapore. The private dinner is actually by a group of people that go for singing and karaoke club. So they went there. I believe they also sang, and singing, or the celebs go everywhere, and there's dinner. I'm not sure if it's a buffet, so calamity. So anyway, another one is linked to the Life Church and Mission Singapore Church, which is one of the 2 churches clusters that we have in Singapore. This is the smaller one with 8, with this included, and the other one got 23. So, and 3 imported cases. So let's scroll down and take a look. So case 151, 51 years old Singaporean citizen. So he is linked to the cluster for the church. So this is actually an interesting case. He got symptoms on the 4th of Feb. He went to the clinic on the 5th, and then on the 13th, and he also went to the polyclinic on the 8th and on the 13th. So not sure why he's still not identified as a possible candidate for the COVID-19. So can you imagine, from the 4th until today? So he was then identified to have attended a gathering on the 25th of January. So that could be where he got it. And on the 22nd, he's actually referred by the MOH, which is the Ministry of Health, to the NCID, the National Center for Infectious Disease, and by then he's already recovered. So they did test the serological test on the 8th March afternoon, confirmed that he actually had COVID-19 earlier. So which means that all the people that he have met and encountered is going to freak out. So let's go on to case 152. So 152 is another of those cases which I just feel like laughing, and it's a 65 years old Indonesian national that arrived on the 7th. He immediately got isolated, and he presented himself at the Singapore General Hospital, which means that he came to Singapore just to get treated. And the next day, yesterday afternoon, he's confirmed to got the COVID-19. So he actually got the symptoms on the 28th, and then he actually tried to get treatment in Jakarta's hospital on the 2nd of March. Apparently they did not test him, or did not really want to test, or really don't take him seriously or something. Not sure why. And he came to Singapore to get a better test, and yes, he got it. And yes, community spreading in Jakarta, more or less confirmed. So because in subsequent cases, you will see why. Case 153, the next case, an imported case, because a Singaporean, 65-year-old female Singaporean, went to Indonesia from the 25th to the 28th Feb. And when she was in Indonesia, she visited her sister, which had pneumonia. So when she came back, she got symptom on the 3rd. He seek treatment on the same day, and then again on the 7th. And he sent to the Singapore General Hospital, the SGH, and the next day afternoon confirmed that she got COVID-19. So, and then for 154 is an imported case of a 52-year-old British national arrived on the 6th and confirmed on the 9th morning. Not too sure where he came from, but as far as I can tell, the whole of Europe is burning with COVID-19. So does it even matter? So the rest of the cases, they are all linked to SAFRA Jurong. I don't really feel like a need to cover it because at least we know where they got it, and wherever they go is a bit too late, because it's a bit too late. You, if they have went to some place that you have went to, good luck. So no worries, all of them will be taken care of. So going back to yesterday announced cases, so it's SAFRA Jurong, I don't really care. So case 147, 64 years old Indonesian male, arrived on the 7th. So he got symptom on the 3rd, and he came by arriving on Seletar Airport. So Seletar Airport is one of the 2 international airports in Singapore. This is actually the smaller one. Changi Airport is the main one. Seletar Airport actually serves only one airline, and the rest is all private planes. So I don't think Firefly, which is the airline that operates out of Seletar, flies to Indonesia. I don't think so. I think it's a Malaysian airline. So he's probably a rich guy. So take his own private plane or chartered plane, arrived with a fever. Immediately he got isolated and did a swab test, and by night time he sent to the NCID, which is the National Center for Infectious Disease, and the next morning confirmed to got COVID-19. So this line looks like he managed to actually stay at his rental apartment for a few hours. So SAFRA Jurong, I don't care. You can see he went to singing and oh god. Okay, so yep. So from today's report, we can sort of tell that community spreading in Indonesia is highly likely, and I suppose we're gonna see a very high uptick in cases. I'm not exactly sure if Indonesia have the capacity to actually do thousands of tests at once on a daily basis, but I believe we're gonna see a very high uptick in the number of people proved to be infected, and it's going to be an upward curve as well. So fingers crossed, and see you soon, and wash your hands.